Okay, so here's the question um, coming from the chat group. It says, I'm thinking I may have an eating disorder. I eat a lot, but I don't gain weight. This person is 5'9" and under 100 pounds. So again, I'm not trying to diagnose or treat anybody over the internet. I'm giving general advice. So if I had these numbers, I would simply, as a professional, punch those numbers into a BMI calculator. So let's do that together. So all of you who are on the computer watching this, go onto Google. That's what I'm doing right now, just so you know how to do this yourself. You put in BMI calculator. Now I'm going to assume that Not Thinking Geek is a male and not a female. So I'm going to put in 5 feet and 9 inches. If it asks for everything in inches, you have to convert it yourself, then do that. And this person says that he is 95 pounds and submit that. Okay, so the calculated BMI is 14. Now, there's two other pieces of information that I would need to have. I need to know how old this person is, and I need to know what his medical history is. And the reason why is we all know that 14.0 for a BMI is pretty low. In fact, for adults, you know, the cutoff is going to be, or as close you are to an adult 18 years old, or even if you're 16 or 17, you're going to go off of that adult BMI. Anything under 18, 17.5 even, that's pretty thin. That could be somebody like me being very, very close to 105 pounds. It put me at a BMI of about 17. So, and I've been there in my life. Now, when you're under 18, those BMIs do tend to run low. That's not a problem. That's pretty normal. But at 5'9", that's meaning that this person, if he's under 18 and still growing, isn't getting enough caloric intake probably and fats to maintain things that require strength. That person may or may not have difficulty sleeping, metabolizing foods. So there could be a number of things going on, such as a thyroid condition. So there could be a medical condition going behind this. Could mean that his body's just chewing up calories really fast and it's hard for him to put any weight on. So yes, that is pretty low and not within the normal range. And for that height of 5'9", that's pretty thin. There's other indicators too, and that is if there's any other kind of behaviors that are fueling, in a sense, no pun intended, a possible eating disorder. And, you know, the questions that I would be asking in general would be, you know, are you doing things that would lead yourself or others to think that you're hiding what you do or think about when it comes to food and activity? So if you're thinking you might be struggling with things about your body image, you might want to count how many times in a typical day you are worried or concerned about food, meaning that you're thinking about it or you're avoiding it or avoiding social situations where there's food. With body image, it might be trying to cover up being thin. And so in one way, you could be proud that you're thin, and on another hand, you're wearing loose and baggy clothes, long sleeves, even in summer, long pants, things to hide the fact that you're on the thinner side, and people would notice that and either ask if you were ill or ask if something's wrong. An example would be a girl that I saw running very, very near my house, of whom another friend also saw her running and said to me, that person needs help. And I looked, and sure enough, it was like a skeleton running. There was nothing there, and she had a very thin t-shirt on and a pair of shorts. And so sometimes people who are very thin will try to hide the fact that they have an eating disorder going on, even though she can't hide the fact her cheekbones were sucked in. She really did look very skeletal. And there looked like there's definitely this veneer of dishealth her skin coloring wasn't quite right. It looked a little bit green or gray. Her hair was very, very thin and damaged. The hair loss or alopecia can come with an eating disorder. The next signs would be things like if that person is purging to get rid of excess calories or anything that he or she is eating, would be burns on the finger, burns around the mouth from the acid after vomiting, abuse of things like diuretics and different kinds of medications to cause you to have more bowel movements, even when you don't want to have them. So there's a whole plethora of things that go along with the eating disorder picture that I would be asking about. Eating disorders are a very, very complex process of thinking and behaving and relationships, and usually require a professional to intervene because in most cases, an eating disorder doesn't just occur, it occurs in a context, and it's the context that often needs some healing too. That's all I'm going to say about eating disorders, but that is my specialty area. I have my own private practice for the last 10 years, Seattle Direct Counseling, and that is seattledirect.counseling.com. And I do treat people with eating disorders. I also treat people with eating disorders that have a dual diagnosis, meaning they also have an additional medical problem that is contributing to the disorder, such as being diabetic. Sometimes people will use their having an eating disorder to overcome their need or their logical understanding that they need to take their insulin, so they will restrict insulin in order to keep their weight down. So that's something else that I can work with. Hope I answered your question, and I'm going to stop record on that particular section and take another question.